Hi, I'm Veda. It's very nice to meet you. So I know when you made the appointment over the phone, you said that you think you may be experiencing some symptoms of depression. Okay. Yeah, and I'm going to ask you a little bit more about that, but just wanted to tell you what we'll do here today first. I am going to be going through a couple of diagnostic questionnaires specifically for depression, but we can branch out into some other stuff if I see anything different. That's pretty much how we would go about diagnosing depression, just seeing if your symptoms align with the diagnostic criteria for major depressive disorder, okay? Alright, so I'm going to be asking you several questions about what you're experiencing, what you're feeling, and we'll go from there, okay? First off, before we get into the questionnaires, what's been going on recently? What are specifically the symptoms that caused you to make an appointment? Okay, I'm going to take some notes just so you know, okay? Okay. Gotcha. I'm really sorry to hear that. How long has this been going on for? Okay, yeah. Does it sometimes get better or worse, or has it been consistently that bad for that long? Okay. No, it can definitely vary and still be major depressive disorder. Right? Do you currently have a general practitioner? Okay. And have you seen them recently? Okay, good. Any health issues? Okay. And are you now, or have you seen a psychiatrist in the past? Okay. And how about a therapist or counselor? Okay, so first time. Okay. And have you ever taken any medication for depression, such as SSRIs? Oh yeah, some of the more common ones would be like Zoloft or Lexapro. Okay, no, gotcha. Yeah, sometimes a general practitioner will prescribe, sometimes a psychiatrist. It just depends on who you're seeing. Okay. So the first questionnaire I'm going to jump into is the Columbia DISC Depression Scale. So these are going to be yes or no questions, and you can elaborate if you'd like, but you also don't have to. It's totally up to you. I may have follow-up questions as well. We'll see when we get there. Okay. So number one, and these all pertain to the last 4 weeks, okay? So over the last 4 weeks. Have you often felt sad or depressed? Have you felt like nothing is fun for you and you just aren't interested in anything? Have you often felt grouchy or irritable and often in a bad mood when even little things would make you angry? Have you lost weight more than just a few pounds? Have you lost your appetite or often felt less like eating? Have you gained weight more than just a few pounds? And have you felt much hungrier than usual or eaten a lot more than usual? Yeah, it can sort of go either way. Both could be symptoms of depression, just depending on the person. Some people are more inclined to lose their appetite and eat less. Some people are more inclined to have a greater appetite and eat more. And then some people, it can fluctuate. So you might have a period where you just can't eat, you lose a lot of weight, followed by a period where you really are hungry all the time and you gain a lot of weight. And most of the time, this has nothing to do with desire for weight loss or weight gain. It's just what your body is telling you at that time. Okay. Have you had trouble sleeping? That is, trouble falling asleep, staying asleep, or waking up too early? Okay. So falling asleep, staying asleep, okay, and waking up too early. Okay. Oh, the trifecta, I'm so sorry. Have you slept more during the day than you usually do? Okay. Do you feel like that is because you're tired, or... Okay, yeah. I mean, it definitely can be partly because you're tired and then partly because maybe you just can't find it in yourself to do anything else. Get that? That's very common. Have you often felt slowed down, like you walk or talk much slower than you usually do? Okay. Have you often felt restless, like you just had to keep walking around? Okay. Have you had less energy than you usually do? Has doing even little things made you feel really tired? Have you often blamed yourself for bad things that happen? Okay. Have you felt you couldn't do anything well, or that you weren't as good looking or smart as other people? Has it seemed like you couldn't think clearly or as fast as usual? Have you often had trouble keeping your mind on work or other things? Has it often been hard for you to make up your mind or make decisions? Okay. Okay, so you think that's been a problem long before the depressive symptoms? Okay. No, that's good to know. Have you often thought about death or about people who have died? Okay. Alright, so that was the first questionnaire. The second one is called Beck's Depression Inventory. This one is a little bit different. Each question has to do with a certain thing, and it provides statements. So I'm going to read the statements to you, and I want you to tell me which one most closely resonates with you, okay? So, number 1, it's about sadness. I do not feel sad. I feel sad. I am sad all the time and I can't snap out of it. I am so sad and unhappy that I can't stand it. Okay. And they're sort of all like that. It increases in severity, the statements. So it'll sort of go from, I don't feel this at all the way to it being incredibly debilitating, okay? And in order to be diagnosed with major depressive disorder, you don't have to have all of these things, and they don't necessarily have to be the most severe. Okay. Number 2, I am not particularly discouraged about the future. I feel discouraged about the future. I feel I have nothing to look forward to. I feel the future is hopeless and things cannot improve. Okay. I do not feel like a failure. I feel I have failed more than the average person. As I look back on my life, all I can see is a lot of failures. I feel as if I am a complete failure as a person. Number 4, I get as much satisfaction out of things as I used to. I don't enjoy things the way I used to. I don't get real satisfaction out of anything anymore. I am dissatisfied or bored with everything. 5, I don't feel particularly guilty. I feel guilty a good part of the time. I feel quite guilty most of the time, or I feel guilty all of the time. Okay. Number 6, I don't feel like I'm being punished. I feel I might be punished. I expect to be punished. I feel I am being punished. Okay. Number 7, I don't feel disappointed in myself. I am disappointed in myself. I am disgusted with myself. I hate myself. Number 8, I don't feel I am any worse than anybody else. I am critical of myself for my weaknesses or mistakes. I blame myself all the time for my faults. I blame myself, for everything bad that happens. Okay. Number 9, I don't have any thoughts of killing myself. I have thoughts of killing myself, but I would never carry them out. I would like to kill myself, or I would kill myself if I had the chance. Okay. Number 10, I don't cry any more than usual. I cry more now than I used to. I cry all the time now. I used to be able to cry, but now I can't cry even though I want to. Number 11, I am no more irritated by things than I ever was. I'm slightly more irritated now than usual. I'm quite annoyed or irritated a good deal of the time. I feel irritated all of the time. I have not lost interest in other people. I am less interested in other people than I used to be. I have lost most of my interest in other people, or I have lost all of my interest in other people. Okay. 13. I make decisions about as well as I ever could. I put off making decisions more than I used to. I have greater difficulty in making decisions than I used to. I can't make decisions at all anymore. Okay, so that has gotten worse. Even though it was something that you struggle with before the other symptoms, you feel like it's gotten worse. Okay. Number 14. I don't feel that I look any worse than I used to. I am worried that I am looking old or unattractive. I feel there are permanent changes in my appearance that make me look unattractive. I believe I am ugly. Okay. I can work about as well as before. It takes an extra effort to get started at doing something. I have to push myself very hard to do anything. I can't do any work at all. Okay. Number 16. I can sleep as well as usual. I don't sleep as well as I used to. I wake up 1 to 2 hours earlier than usual and find it hard to get back to sleep. I wake up several hours earlier than I used to and I cannot get back to sleep. Number 17. I don't get more tired than usual. I get tired more easily than I used to. I get tired from doing almost anything. I am too tired to do anything. 18. My appetite is no worse than usual. My appetite is not as good as it used to be. My appetite is much worse now. I have no appetite at all anymore. Number 19. I haven't lost much weight, if any, lately. I have lost more than 5 pounds. I have lost more than 10 pounds. I have lost more than 15 pounds. Okay. So even though that one does have a scale, like 5, 10, 15 pounds, that is really relative to the person. So 5 pounds of weight loss on one person might be a lot more shocking than 5 pounds of weight loss on another person. Same with 10 or 15. So I don't put as much weight, pardon the pun, on that question, but it does ask it. Okay. Number 20. I am no more worried about my health than usual. I am worried about physical problems like aches, pains, upset stomach, or constipation. I am very worried about physical problems, and it's hard to think of much else. Or I am so worried about my physical problems that I cannot think of anything else. Okay. And number 21. I have not noticed any recent changes in my interest in sex. I am less interested in sex than I used to be. I have almost no interest in sex. I have lost interest in sex completely. Okay. Alright, thank you. And this is one more. This should be the last diagnostic we do for depression, though I believe there's another one I want to add afterwards. We'll see what comes out after this, okay? So this is over the last 2 weeks. So over the last 2 weeks, how often have you been bothered by any of the following problems? The answers are not at all, several days, more than half the days, or nearly every day, okay? So number 1, little interest in pleasure doing things. Not at all, several days, more than half, nearly every day. Feeling down, depressed, or hopeless. Not at all, several days, more than half, nearly every day. Trouble falling or staying asleep, or sleeping too much. Okay. Feeling tired or having little energy. Would you say more than half? Okay. Poor appetite or overeating. Feeling bad about yourself, or that you are a failure or have let yourself or your family down. Trouble concentrating on things such as reading a newspaper or watching television. Moving or speaking so slowly that other people have noticed. Or the opposite, being so fidgety or restless that you've been moving around a lot more than usual. Thoughts that you would be better off dead, or thoughts of hurting yourself. Okay. How difficult have these problems made it for you at home, work, or with other people? Not difficult at all, somewhat difficult, very difficult, extremely difficult. Okay. Thank you. And I did want to add one more, just because of some of the symptoms you've been telling me about and some of your experiences. I wanted to talk a little bit about dissociation. So this is going to be the brief dissociative experiences scale. It's a short one. So it is rated on a scale of 0 to 4. Not at all, once or twice, almost every day, about once a month, more than once a day. About once a day, more than once a day. And it's how often this has happened to you in the past 7 days. So we're thinking about the past 7 days. And again, the scale is not at all, once or twice, almost every day, once a day, more than once a day. Okay. I find myself staring into space and thinking of nothing. Okay. People, objects, or the world around me seem strange or unreal. I find that I did things that I do not remember doing. When I'm alone, I talk out loud to myself. I feel as though I were looking at the world through a fog, so that people and things seem far away or unclear. I I'm able to ignore physical pain. I act so differently from one situation to another that it is almost as if I am two different people. I can do things very easily that would usually be hard for me. Okay, thank you. Yes, so dissociative experiences or dissociation can be tied to depression, and it sounds like maybe you were having some of those experiences, but it doesn't look like it really meets the severity to really focus on that. However, from what you've told me and what the questionnaire reveals, it does look like you might be suffering with major depressive disorder, and I know you were already pretty aware of that. So let's talk about how we would treat this. Okay, let's put that aside for a second. So the first way of going about treating it or improving it would be what you've already started, which is therapy. And we use a type of therapy called cognitive behavioral therapy. It's very effective for depression and anxiety and other disorders, but very effective for depression in your case. So I would like to see you every week, and we can pursue the cognitive behavioral therapy. A lot of it is talk-based, so we'll talk about your mindset, your experiences, and we'll work on coping skills and ways of improving the way you feel, basically, and relieving some of those depressive symptoms. Now, I know you were a little bit interested in talking about medication. We do have a psychiatrist on staff, and they primarily do medication management. So what we could do in conjunction with the cognitive behavioral therapy with me, I could schedule you an appointment with our psychiatrist. Okay, yeah. So typically what they'll do is a first appointment that's going to be sort of similar to what I've done, where they're going to ask you some questions and then talk about some of your health history and determine a medication to try that would hopefully help with your depressive symptoms, okay? It is not always the case that the first medication is going to be the best one for you. Sometimes you do have to try a couple. However, especially with depressive disorder, the medications have been long tested and are extremely effective. So you'll probably find some relief from that. But I do recommend that you do that in conjunction with the cognitive behavioral therapy, because together they are extremely effective in treating depression, okay? Alright, perfect. So let's see when we can get you in with our psychiatrist. Okay. They do have a couple openings next week. Would Wednesday work for you? Okay. Oh, that's perfect, yeah. Wednesday at 4 p.m.? Okay, so let me just get this in here. Put that in there. So that's Dr. Girardi that you're going to be seeing, and she does almost exclusively medication management. She doesn't really do talk therapy or cognitive behavioral therapy with her patients, which is where I come in. So we'll work in tandem to create a treatment that's going to be most effective for you. And we'll also communicate on our end. So she's going to have all of my notes and a briefing on what I've seen and what you're experiencing. And then I will have her notes as well on the medication that she's choosing for you and the route that she's decided to take, okay? So we'll do next Wednesday at 4. And those are usually 30-minute appointments. I can get you in at 4:30 if that works for you, if you want to have an appointment with me at 4:30 for the cognitive behavioral therapy. Okay, excellent. That way you don't have to come out twice. So we have 4, 4:30. And if she runs a couple minutes over, that's okay. I'll be aware of it, and you can just come to my office right after, so that's no problem. She usually doesn't. It's pretty fast. So really what she usually does is prescribe a medication, and then generally she'll see you 2 weeks to see how you're doing, then another 2 weeks, and then it will be monthly medication management appointments. For me, I'd like to see you weekly so that we can pursue the cognitive behavioral therapy as well. Okay, perfect. So, do Wednesdays at 4:30 look good for you going forward, or is there a better day and time? Okay, that's awesome. So we'll keep that on the books then. And I really look forward to working with you and helping you work through this, because I know you've been suffering for some time and we don't want you to have to deal with this anymore. Okay, so you are all scheduled for next week. We will start treatment in earnest at that point, but yeah, it definitely does look like a major depressive disorder. So I think this is going to be the best course of treatment for you, and I think you're going to see a lot of improvement and feel much better pretty quickly, okay? Alright. Do you have any questions for me? Yeah, I can't really say. I don't know what medication you're going to be started on. That's really something the psychiatrist is going to have to go over, but a lot of the time with depressive disorder, we'll look into SSRIs like we talked about before. Yeah, me too. Okay. So yeah, if you want to do some research on those beforehand, potential side effects, she should tell you all of that stuff, but I understand if because I'm that kind of person too, where I like to do my own research. So, all right. Well, I'm very excited to work with you, and I will see you next week, okay? If in the meantime anything happens, if you feel like you need to come in sooner, if things get worse, send me a message through the portal or call the office, okay? And I'll be able to get you in. All right. I'll see you soon.